I'm Dr. Emily Carter, a board-certified urologist with over 12 years of experience helping men over 60 reclaim their prostate health, their urinary function, and the physical confidence that so many of them have quietly accepted is no longer available to them. And I want to challenge something you may have been told, that prostate-related decline after 60 is a one-way street, something to monitor and manage, but never meaningfully reverse. In my clinical experience and in the research I follow closely, that belief is far more negotiable than most men realize. Today, I am going to show you a specific 1-minute daily practice that supports prostate health, improves pelvic circulation, and activates a part of your body's own protective mechanism that most men over 60 have never been told exists. And I want to be clear from the beginning, this is not a folk remedy. This is grounded in what we understand about pelvic anatomy, lymphatic drainage, and the vascular supply to the prostate gland. By the end of this video, you will know exactly what to do, why it works, and why starting today rather than tomorrow actually matters. Before we go any further, drop a comment below and tell me this. What's one thing you've accepted about your prostate health or your urinary function that you're not entirely sure you should have? I want to know where you are. And now let's get into what the research actually supports. Here is what most men over 60 have never been told about their prostate. The prostate gland sits at the base of the bladder, surrounding the urethra, in a region of the body that is, by design and by daily habit, chronically compressed, chronically still, and chronically undercirculated. Most men spend the majority of their waking hours sitting. When you sit, the full weight of your body presses directly onto the perineum, the region of tissue between your sit bones that contains the vascular and lymphatic pathways that supply and drain the prostate. Hours of daily compression on this region restricts blood flow, impairs lymphatic drainage, and creates the kind of chronic, low-grade congestion in the pelvic tissues that contributes to inflammation, urinary symptoms, and the gradual functional decline most men attribute entirely to age. This is not a fringe hypothesis. Chronic pelvic congestion and its relationship to prostate symptoms has been studied and documented in urological literature for decades. And the intervention I am about to describe addresses it directly, costs nothing, requires no equipment, and takes less than 60 seconds. The spot is the perineum, and the practice is perineal self-massage combined with deliberate pelvic floor activation, done together, consistently, once daily. Let me explain what this actually does at a biological level, because understanding the mechanism is what will make you take this seriously rather than dismiss it. The perineum sits directly beneath the prostate and the pelvic floor musculature. When you apply gentle, sustained pressure to this region and combine it with rhythmic contraction and release of the pelvic floor muscles, several things happen simultaneously. First, you mechanically pump the venous and lymphatic vessels in the immediate area, encouraging the drainage of stagnant fluid and metabolic waste products from the pelvic tissues. Second, you stimulate local blood flow, increasing the delivery of oxygen and nutrients to the prostate and surrounding structures. Third, you activate and strengthen the pelvic floor muscles themselves, the same muscles that govern urinary continence, support erectile function, and regulate the muscular tone of the structures surrounding the prostate. And fourth, you stimulate the perineal branch of the pudendal nerve, which carries both sensory and autonomic fibers that influence pelvic organ function in ways that extend well beyond what most men have been told is possible through simple daily practice. The pelvic floor is one of the most neglected muscle groups in men's health. We talk about it extensively in women's health. We have largely failed to bring that conversation to men, and that failure has consequences. A weak, poorly coordinated pelvic floor in a man over 60 contributes directly to urinary urgency, urinary leakage, incomplete bladder emptying, reduced ejaculatory force, and erectile dysfunction. These are not inevitable features of aging. They are, in significant part, the consequences of a muscle group that has never been trained and a tissue region that has never been given the circulation it requires. Now let me walk you through exactly how to do this correctly. Find a firm surface, a chair, the edge of your bed, the floor. You can do this seated or lying on your back with your knees bent, whichever is more comfortable. Using 2 or 3 fingers, locate the perineum, the firm region of tissue between your sit bones, behind the scrotum and in front of the tailbone. Apply gentle but deliberate downward pressure. You are not pressing hard. You are applying enough pressure to feel the tissue respond. A mild sense of firmness or fullness is normal. Hold that pressure steady. Now, while maintaining that gentle external pressure, perform a pelvic floor contraction, the same motion as stopping the flow of urine midstream. Contract, hold for 3 seconds, release fully. Repeat this cycle 10 times. The entire sequence takes approximately 60 seconds. That is the practice. Done daily, consistently, over a period of 4 to 6 weeks, the cumulative effect on pelvic circulation, pelvic floor tone, and the tissue environment surrounding the prostate is meaningful and documented. I want to add one layer to this that elevates the practice significantly. Immediately after the perineal massage and pelvic floor sequence, stand up and perform 10 slow, deep squats, body weight only, no resistance required. The reason for this is mechanical. The deep squat position opens the pelvic outlet, stretches the pelvic floor muscles through their full range, and creates a pumping action in the pelvic vasculature that amplifies the drainage effect you just initiated with the massage. The combination of the two, perineal compression followed by full pelvic opening, creates a cycle of compression and release that is far more effective than either practice alone. This is the kind of intervention that costs nothing and asks only for consistency. And consistency is where most men either win or lose the conversation with their own body. I want to tell you about a patient I'll call Richard. Richard came to see me at 66 with a presentation I see constantly. Nocturia waking him 2 to 3 times per night, urinary urgency that had begun to dictate his schedule, and a general sense that his body below the waist was operating on its own terms rather than his. He had been told his prostate was mildly enlarged, that this was age-appropriate, and that the options were watchful waiting or medication. He had accepted that framing completely. He was sitting at a desk for 8 to 10 hours a day. His pelvic floor had never been addressed. His perineal circulation had never been discussed. We added the daily practice I just described to his routine. We addressed his sitting habits, a standing desk, deliberate movement breaks, positional changes throughout the day. Over 8 weeks, not 2, 8, his nocturia reduced from 3 episodes per night to 1. His urgency symptoms improved measurably. He described feeling less pressure, less heaviness, more control. His follow-up scores on a validated urinary symptom questionnaire showed clinically meaningful improvement. He told me that nobody had ever explained to him that there was something this simple and this direct that he could do himself. That conversation represents everything I believe about what men over 60 deserve from their health care. Here is what I want you to do starting today. Once per day, morning is ideal, before you sit down for any extended period, perform the perineal self-massage and pelvic floor sequence I described. 10 contractions, 60 seconds, gentle and consistent pressure. Follow it immediately with 10 slow body weight squats. Do this every day for 30 days without exception. Track what changes: your urinary urgency, your nighttime waking, your sense of pelvic ease and control. These are not small data points. They are your body communicating directly with you about what is happening in real time. If you are managing an active prostate condition, undergoing treatment, or have any pelvic surgical history, please discuss this practice with your urologist before beginning. That conversation is part of taking your health seriously, and I encourage it. Gentlemen, I want to say something directly to the men watching this who have accepted the slow drift of their prostate health and their pelvic function as an unavoidable feature of getting older. Your pelvic floor is still trainable. Your perineal circulation is still improvable. The tissue environment surrounding your prostate is still responsive to the right inputs. The research on pelvic floor rehabilitation and pelvic circulation in older men is consistent and encouraging, and the barrier to accessing those benefits is not medical complexity. It is simply knowing what to do and doing it every day. Your body has more capacity than you've been told. This is not false hope. This is where the evidence actually points. If there is a man in your life who is dealing with urinary symptoms, disrupted sleep, or the quiet indignity of a body that no longer feels under his control, share this video with him. Because watchful waiting is not the only option, and 60 seconds a day is a very small investment for what the research shows is genuinely within reach. I'm Dr. Emily Carter. The evidence is clear. The perineum is one of the most overlooked and most accessible intervention points in men's health after 60. And 1 minute of deliberate daily attention to this region may do more for your prostate health, your urinary function, and your pelvic vitality than anything else you are currently doing. Take care of yourself, and I'll see you in the next one.